tremendous message. We are at an historic point.
We are the wealthiest nation in the world. We are, in many ways, we like to say the greatest nation in the world, and yet we have been living under this whole anti-tax, anti-government, conservative ideology that's let the government not be able to do what it needs to do to ensure that we have a decent health care and health insurance system, and instead the insurance companies have been running roughshod all over us and running the show, and as a result we are now ranked, whatever it is, whether it's 28th or 32nd or 37th by whatever measure, shortest lifespans and highest infant mortality among all the wealthy nations. It's just appalling that our nation should be ranked so poorly in that sense.
I represent Doctors for America. It's an organization of about 16,000 doctors, more than 16,000 doctors across the United States. And we are basically fighting for healthcare reform. And we're doing this because of the tragedies, the disasters we see in the lives of the patients we take care of every day in clinics and hospitals all over the country.
You know that my healthcare insurance denied me having an ultrasound because they deemed it not necessary. My doctor had to take time out of her busy schedule to fight them.
I went for an OBGYN exam, and I had switched doctors, not because of any reason except that my friends recommended him, so I changed. 3 months later, I got a check in the mail from Blue Cross and Blue Shield for the premium that I had paid them for that year, and said, you're no longer insured. They figured out that if I went to a specialist, that I probably maybe had cancer or something like that, but I didn't. And I went to them and I said, I don't have anything, you know, here, take my money. Nope. They wrote me off. And so I said, okay, I'm not going to have insurance for a while. Well, then what happened was, in 1997, early on, I contracted rheumatoid arthritis, and just the expenses related to that were so awful. They were taking a toll on me. Just seeing the rheumatologist was $450 for a 20-minute.
This is where we were 40 years ago. Medicare was brand new. Since then, we have mediated all of the competing demands for health care, our most precious thing we have, our bodies themselves, life itself. Somehow we have mediated all that through insurance companies. Never let the opponents of health care reform drive a wedge between us and our doctors. Our doctors work miracles. Our system can do miracles, but they're fighting a totally improperly organized health care system.
How dare they? Who has the right to decide if you live or die based on whether you can afford health care? How dare they? How dare we, as citizens of the United States, allow this to continue?
I think we have to bear in mind some of the things that Dr. King said. Number one, we have to act in the present, but with our eye always on the future.